Clerk will read the next bill.
Senate Bill 172 relating to infant screening and declaring an emergency.
Question now arises upon third reading and final passage of Senate Bill 172. Representative Keny-Guyer.
Thank you, Madam Speaker. Senate Bill 172, which passed the Senate and House committees and the Senate floor unanimously, requires all birthing facilities to screen newborns in Oregon for critical congenital heart disease, CCHD. This bill will save lives, colleagues. 8 out of 1,000 infants, which is approximately 360 in Oregon each year, are born with a congenital heart disease. Of these, roughly 80 are critical. Critical in the CCHD means that the heart defect causes severe, life-threatening symptoms and requires intervention within the first hours, days, or months of life. CCHD is the most common cause of death in the first year of life. Pulse oximetry screening is a safe, non-invasive bedside test that will identify babies with CCHD earlier in their lives so they can get treatment as soon as possible. CCHD screening is cost-effective. Recent cost estimates for pulse oximetry screening range from less than $5 to $10 per infant, depending on the protocol. Many hospitals in Oregon are already implementing this screening because they recognize the life-saving and cost-effective benefits. The follow-up care and echocardiograms that are needed for these babies will be needed whether or not the screening is done, but the life and medical costs will be higher if the babies are not identified early. Medical costs for one family for their ER visits and NICU and ICU stay to stabilize their baby for surgery can easily total more than $250,000, the vast majority of which can be avoided if the baby had been diagnosed right after birth. Caleb's family is one of the many families directly affected by this and is tremendously supportive of Senate Bill 172, along with the American Heart and Stroke Associations, March of Dimes, OMA, Oregon Medical Association, Legacy Health, Mended Little Hearts, and many others. I urge your support.